आज ओपन हेल्थ डे है, जिसका मतलब ये है कि आप अगर आपके पास कोई भी सवाल है अबाउट हेल्थ प्रॉब्लम दैट यू आर फेसिंग और अ लव्ड वन इज़ फेसिंग, और अगर आप चाहते हैं उस पर आयुर्वेदिक पर्सपेक्टिव लेना, तो आप हमें कॉल कर सकते हैं एंड गेट गाइडेंस फ्रॉम आवर अमेजिंग Ayurveda expert. Our guest today is Dr. Anil Mehta, who's been practicing Ayurveda for over 35 years and has also written over 30 books on Ayurveda. So it's a great opportunity. अगर आपके पास Dr. Mehta, thank you so much for joining us.
Thank you for inviting me.
So, Dr. Mehta, आज Open Health Day है, तो we will get a lot of calls from, for all topics. लेकिन I want to particularly start about allergies कि मतलब spring से ज़्यादातर शुरू होती है, but कुछ hay fever जैसी पोलन इरिटेटेड जो एलर्जीज होती है वो समर तक रहती हैं. सो टेल मी, अगर somebody is prone to allergies because of the pollen, whether it's spring or summer, तो कैसे, what are the kind of Ayurvedic natural remedies they can use at home?
Yeah, as the word say itself that it's allergy. Allergy, why it's not whole year, why it's only in the spring season, that we have to understand. You see, in Ayurveda, we are convinced that body is a perfect mechanism. Before the time of spring, that is winter season, in winter season, consciously or unconsciously, we eat a certain type of food that increases cough in the body. These are all heavy stuff. Naturally, we feel like eating heavy stuff in the winter months. By doing that, few months, November, December, January, February. So 4 or 5 months, if you are doing that, having heavy stuff, our body increases cough to cope with the weather. It gives sort of immunity. So what happens after having 4 or 5 months heavy food, in spring season, sun is rising, temperature is rising, so all that accumulated cough that starts coming into the body because the temperature is melting, in other words, it comes in the blood flow. And now our body is so intelligent, it wants to throw everything what's not needed, what's extra. So that cough, what was the body part, in this weather, it will get diluted because of the temperature, and body on its own would like to throw it away. So the people, those who are having kapha constitution, those who are having kapha more in the body, they are more prone to get this hay fever in spring season. Otherwise, all other constitution people, they will get whole year. Right? So it's person to person treatment. So that's why, if you understand the mechanism, that how it comes in the spring season, someone is feeling rhinitis. The other name of this is rhinitis, rhinitis, that is nose, running nose, and having irritation, itching in the eyes, and sore throat, things like that. This is all allergy. But only those people will get more in this weather who is having more kapha and body is not able to throw it away itself.
So that means that the body is struggling.
Body is struggling.
समझ में आ गया कि it's not required and wants to get rid of it, but he's not being able to do it.
Right.
कैसे, what can someone do?
So Ayurveda has got very good tips that we should help our body to eradicate that cough what is coming free now. So you should not be eating things what is kapha increasing. We should just give opposite to that. So for example, there are few food what we generally consume. That is yogurt. Black pepper, yogurt and banana and rice. These three things are kapha increasing. So kapha is already there. So in this weather, we should avoid taking banana, yogurt, and rice. So one can have option. You can eat roti. You can avoid yogurt very easily. You can avoid cold things very easily.
So is it true to say then that जैसे मौसम बदल रहा होता है उस समय भी avoid things that can lead to cough, like banana or rice?
Yeah, only in spring season, because I told you in winter we have accumulated kapha, consciously or unconsciously. So it doesn't happen in summer months. Only in the winter we have accumulated. In spring season it tries to come out itself.
And अगर किसी को pollen lead hay fever type allergy हो रही है तो फिर उसके लिए वो क्या कर सकते हैं?
Yeah, we have to increase the immunity. As I told you, not everybody is prone to this type of diseases. There are typical persons, typical personalities. So they should avoid food. They should help their body to eradicate this, to come out of this. That's why Ayurveda has got very, very good technique therefore, that end of the winter, let's say in March or last week of February, one should go for emitting techniques. Emitting is that is sort of vomiting. So everything whatsoever is accumulated in the upper part of the stomach and lungs, that is a place where kapha stores, where all that mucous membrane whatsoever increased, this is a part where it accumulates. So we use this technique, this type of things we use in our food that makes you throw everything out, vomit everything out of it. So it should be done under supervision of Ayurvedic doctor.
Amazing. Thank you very much for that. Dr. Mehta, we have a caller for you who's chosen to be anonymous. Good evening. Please बताइए अपना सवाल.
Hello.
Hi. Can you
hear
us?
Yes. My question is that it's basically about someone who's about 22, 23, and they've had like eczema, female, since the age of say about 5 years, and you know, it's basically very, very dry skin, and kind of it really flares up. You know, she really sort of like, you know, watches her diet and everything, but it's basically on, you know, like the Western, like, you know, creams and lubricants and what have you. And now that, you know, she's going into, like, you know, the career sort of side of things, you know, now that she's finished studies, it's kind of, you know, a bit concerning, because obviously, you know, you are working every day, traveling and everything. So we wanted to understand whether there is something like permanent, whether to eat, or because some people say that, you know, it's your liver that has to be clean and the blood has to be clear and that. And I was hoping if the kind of shed some light and perhaps give some advice, please.
Yes, I understood your question. It's like that.
Do you have any question?
Yeah, I understood that. And I'm going to explain you. You see, this is allergic reaction. Most of the skin problems are because of the reaction to a lot of stuff. It can be dogs, cat, hot stuff mite, dust mite, and environmental pollution can be a reason also. So what we can do, we have to increase the immunity, and very easily it can be done. And there are few herbs what has to take and avoid that allergens with what she is reacting to. But what you, I will tell you the herbs for that. These are two herbs. One is guduchi. Guduchi is Tinospora cardifolia, that is to increase the immunity, and it's very, very good for the skin. And secondly, sirish, S-I-R-I-S-H. This is Albizia labec, and this has to be taken continuously. This will increase our immunity. And second, what you said, that what to do with people say that liver has to be cleaned. No, it's like that with the reaction, our body produces so many enzymes, and that enzymes are reabsorbed and come in the blood. And that blood has to be neutralized, not the liver. We have to neutralize that acid in the blood. That we say that one has to get soda bicarbonate type of thing, that is neutralizer, that is alkalizer. This is just opposite to that acid. Acid is being formed, it has come in the blood, and you should give something just opposite to that, that is soda bicarbonate. That is basis, that is alkalizer. Alkalizer and acid, that will get neutralized and body will get clean itself. And it can be taken 0.5 gram to 1 gram every day for 1 to 2 months. Not more than that. A lot of Google doctors, they recommend a lot of soda bicarbonate, but that's not good. 0.5 to 1 gram maximum can be taken, and she should avoid taking sour things like grapefruit and acid, vinegar type of thing. All the acidic thing has to be stopped except lemon. So yogurt is also acidic in this skin diseases. So this what you can do: Albizia labec, guduchi, and at home you have got curcuma, haldi. These are things which can be done. Otherwise, if doesn't happen, then you have to consult your doctor. After investigating, he can guide you better.
Thank you very much for that, Dr. Mehta. Dr. Mehta, we have another caller. Good evening, Ajmer. How are you today?
Hello.
Hi, good evening.
Hello.
Hi, please tell us your question.
Am I connected? I want to speak to doctor, please.
Yes.
Yes, I'm listening. Go ahead.
Hello, Dr. Mehta.
Ji Janab.
Good evening.
Good evening.
I want to ask you about my wife. She has got osteoarthritis.
Yes.
In her knees. And she has also got in muscles, you know.
Yeah.
Arthritis in her muscles.
Yes. I understood. Osteoarthritis is mostly in the your knees. Is she on overweight? That's one of the reasons. She's overweight and whole day she's working.
She's only 9 stones. Even less than 9 stones.
Okay. Then it's because of the, it's a sort of a rheumatic disease, and it's a say, metabolism problem. It means that she's eating a special few type of protein what is not being digested in the body. So it's a protein metabolism. So one should avoid having much protein in your food. So proteins are in meat, eggs, and dals, whatsoever we eat. So she should avoid that, and weight should not be much. And certainly she should take things like boswellia. It's anti-inflammatory. It's Ayurvedic drug. Boswellia you can buy from any Ayurvedic store here, and the rest from in the food. She should avoid that proteins, and rice should not be taken. If you eat rice, it should be well cooked, and water should be thrown away. Always eat little less than body can digest, because it's because of the ama and vata. Ama is undigested food rest that travels into the body, comes in the joints, and so with the food you can do lot. And good herbs for these are ginger and your black pepper. This should be extra in the food. So try this, and boswellia should be given 3 months, not more than that. After that, again, check with your Ayurvedic doctor.
Amazing.
All right?
Thank you very much for that,
Yes.
Dr. Mehta.
My pleasure.
Mr. Ajmer Singh, thank you very much for calling. You're a very caring husband. Dr. Mehta, you know, the first caller we had, eczema is extremely common in the UK.
Yeah.
And like, bachon mein bhi hota hai, some kids are born with it. And like, I remember a few days back, we had received an email about a patient, and very frequently when we talk health, psoriasis as the skin condition comes very often.
Yeah.
So I was wondering what you would say about that. Is it similar?
No. It's not similar. Psoriasis is different than eczema. Eczema is mostly because of the allergic reaction.
Yeah.
Allergic reaction can be on different part of the body.
Yeah.
If it's on the mucous membrane, then a lot of people get asthma, bronchitis, hay fever,
Yeah.
things like that is on mucous membranes.
Yeah.
So that is on soft tissue of the body. And other one is that it comes on the skin.
Ji.
These are rashes.
Yeah.
So one has to avoid allergens. And secondly, they have to improve their immunity. These are both ways we have to work.
Ji.
So avoidance of the reason is the
कैसे
treatment.
पता चलेगा कि उनको किस चीज से हो रहा है?
Yeah, this is very difficult question, because in doctors they can check 40, 50, 60 things.
Yeah.
And we come in contact with 1001 things.
Ji.
So that's why immunity increasing is the only a good way to treat that. That's a good option.
Okay.
So Ayurveda goes that for. So it is like that. You should imagine that our digestion system is like a fire.
Yes.
If a fire is good, strong enough, then anything you come in contact, anything you put in the fire, it will burn. There won't be left behind. Body can't react to that because it's burnt. It's transformed. It's metabolized. So if no fire is not enough, so you can't burn even paper in that. If fire is enough, you can put anything. You can put my pen, cup, anything. It will. So that is the policy. That's the way of treatment what we give. That we ignite fire, digestion fire, to metabolize things whatsoever he come in contact with and he eats. So that is approach, Ayurvedic approach, that digestion system has to be corrected.
It's a fair point. In fact, Ayurveda हमेशा root cause पे जाने की कोशिश करता है, not just treat it short term. So tell me, and immunity is a very common problem because technically speaking, cold भी तभी होता है जब किसी की immunity low होती है, because we are facing all these viruses all the time. Whether हम लोग जब लंदन में ट्यूब में है, हमारी तो ट्यूब भी इतनी compact है that you are always kind of in contact with someone who has cold or the other person. So अगर immunity low है, so tell us a few ways.
I will tell you in very simple language what immunity is.
Yes.
Our body is nothing than 7 types of tissues. Our body is made of 7 tissues. It's plasma, blood, muscles, fat, bones, bone marrows, and sperms or eggs. So body is nothing except these 7 tissues. If these 7 tissues are quantity-wise and are enough, if they are quantity-wise enough, then they can work quality-wise as well. Rather, it will work quality-wise only if it's quantity-wise enough. So quantity-wise, creating more plasma, enough blood, enough fat, enough bone marrows, enough all the 7 tissues what I just mentioned, then where can disease occur? Never, nowhere, because all the 7 body tissues are quantity-wise good and they are working quality-wise as well.
ठीक है, ये बहुत बढ़िया बात बताई आपने. एक कॉल आई है आपके लिए, लेकिन उसके बाद we'll continue the conversation.
Yes, this one has to understand this.
Good evening, Kedar. Can you hear us?
मेरे को न्यूराइटिस का प्रॉब्लम है, तो उससे मेरे को पग में बहुत जलन होती है. I'm 83, but still feel apart from this neuritis. वो हिसाब से मैं प्रॉपर चल नहीं सकता हूँ, बैलेंस नहीं रहता है, से चलना पड़ता है. जो कभी आपकी ब्रांच इधर बर्मिंघम में होए तो मैं उधर जाके बता सकता हूँ, और आप क्या एडवाइस दे सकते हो?
जी जनाब, this neuritis, what you are saying, it's actually complication of diabetes, sugar disease. So have you got this type of problem, sugar or diabetes?
With diabetes, I am on the borderline.
Yes, mostly it's because of the complication of diabetes. So herein, 3 vitamins body is not getting enough. These are 3 vitamins you should take: B1, B6, B12. Your physician, your family doctor, he can prescribe that to you. This comes with the name Neurobion Forte. Neurobion. And this you should certainly take 5 injections in a year, and your GP will give you this. Otherwise, you can try these tablets also, but tablets are not working that enough. And second, what you can do yourself is there is called medicine with name Kounch, Kounch. Latin name is Mucuna pruriens. With this name, these are neurotransmitters. This is very good to improve blood circulation in the nerves. So you can buy this on your own from any Ayurvedic store here, or internet. You can Google on internet and you will find that product. And third, what you can do yourself, just take sesame oil or mustard oil and give yourself very gentle massage to your area what far is from your heart, like your hands, your feet. So that's what you have to do. This is what you can do, and rest GP will prescribe for you Neurobion if you request him, and he will certainly do that.
Thank you very much for that, Dr. Mehta. Our next caller is chosen to be anonymous.
All right.
Good evening. If you can hear us, please tell us your question. Please.
Hello.
Yes.
Hello.
Hi. Can you hear us?
Yeah, I can hear you. Yes.
Please tell us your question.
My question is.
Yeah.
Can I go ahead?
Yes, yes. Go ahead. Go ahead.
Okay. On my left leg, I haven't fallen down or anything, but it's just. I don't know whether I stretched just on near my knee or what, but I had an MRI.
Yes.
And they said that on the patella, on the top part of the knee, there's water, and a little bit on the side. So I can't really, it doesn't hurt all the time, but it does hurt now and then. So is there anything you can suggest?
Yeah, if MRI has not detected anything, then it's very difficult to say. You said pain is not always, so it in some posture you are getting pain.
Just around the knee, and when I walk, if I stand on one side, one position, it hurts. But the water, they said, only thing we can do is keyhole, but I don't want to do keyhole.
That is keyhole operation, yes. But it's very difficult to tell you without examining, because MRI hasn't detected anything. So what you can do, just try for 2 months. Try this.
There's nothing. There's a little bit osteoarthritis, and that's it.
So that's what I'm suggesting. The first caller also has suggested the same thing for our knees. That it was Boswellia.
How do I get rid of that water?
Yeah. This is because of the internal infection. Otherwise, water was not there. So it is because there is, how you say, it's coming against each other, all that cartilages. And there is infection, internal infection. But MRI had to detect that. But you say it's not detected. What you can do, try Boswellia. You can buy here from any store. Take this for 2 months, Boswellia. If it happens, if it gives you good health, it's fine. Otherwise, you have to go to GP. He will give you cortisone injection in that, and that might help. But Boswellia you can try for 2 months. 2 months, if it doesn't help, then it won't help 6 months also. So try for 2 months.
Is that the Ayurvedic name of the medicine?
Yeah, Boswellia is the Ayurvedic name of the medicine.
Thank you very much, Dr. Mehta. Thank you very much, ma'am, for your question. But just to let you finish, Dr. Mehta, talking about immunity, like I love the logic you gave. But are there certain ingredients that are readily available at home जिससे कि हम immunity बढ़ा सकते हैं?
So one has to understand, if all that 7 body tissues are quantity-wise enough, only then they will work quality-wise. If all the tissues are enough in quantity, then where will disease attack? Nowhere. It means we have to have our digestion good. It's because of the digestion only that taken food in will convert into the 7 body tissues.
Absolutely.
So we have to take care of our digestion. One has to eat on time. One has to take complete food. All 7 type of, all 3 type of body food item we have to take: protein, carbohydrates, fats, in the proper ratios. And then, of course, what I will tell you, and it goes with this topic very, very well, that why one gets allergy, this and that, lack of sleep is one of the major reason.
Bilkul.
The people, those who don't get enough sleep, they are prone to get this type of diseases. Lot of immunity problems comes because of that. And one of other episode last year, I told in my show that in coming years, you will hear one new disease, that is a lack of sleep syndrome. And I associate this disease, allergies, this rhinitis, hay fever, with our sleeping habits. People don't get enough sleep.
That's a very good point.
So digestion and sleep, these are 2 major pillars for our immunity.
Love it.
And besides that, patient can have good fats, that's very, very important. Good fats, omega-3, we get in Ayurveda from desi ghee. It's clarified butter. Ghee every Indian knows, and that should be taken in proper dose. Otherwise, omega-3 can be from fish oil, omega-3 from the flaxseed oil. These are food derivatives. And enough vitamin C from the fruits, and enough sleep and digestion. In the digestion, what a lot of Europeans, they don't do, they are lacking that they don't use spices, what works for the metabolism. That two very specific things are black pepper and good type of salt. Salt, they are so afraid of here, but I tell everybody that salt is needed. That should be special salt. That is a Himalayan salt. That's Himalaya salt.
Kala namak, is that
No, it's not.
Okay, it's pink salt. It's Himalayan.
Yeah, Himalaya salt.
It's time to take a break, but I love what you just said. Especially what Dr. Mehta just said, that, you know, people think that, oh, I have cold, I need to pop in some medicines, but just check how much sleep you're getting. ब्रेक का टाइम है, लेकिन जल्दी से वापस आएंगे, और अगर आपके पास डॉक्टर मेहता के लिए किसी भी हेल्थ प्रॉब्लम के लिए सवाल है, फ़ोन उठाइए, हमें कॉल करिए. सी यू आफ्टर द ब्रेक. वेलकम बैक. ये है जी कंपेनियन. आज है हमारा ओपन हेल्थ डे, लेकिन ट्विस्ट के साथ हम बात कर रहे हैं अबाउट आयुर्वेद एंड कैसे आप इस एंशिएंट मेडिसिन सिस्टम को अपना सकते हैं टू फाइट बेसिक हेल्थ डे टू डे हेल्थ प्रॉब्लम्स. अगर आपके पास कोई भी सवाल है, देन वी हैव द वंडरफुल डॉक्टर अनिल मेहता हियर इन द स्टूडियो विद अस. नंबर्स स्क्रीन पे हैं, आप हमें कॉल कर सकते हैं. सो डॉक्टर मेहता, यू वर टॉकिंग अबाउट हाउ लैक ऑफ स्लीप इज लीडिंग टू ऑल द एलर्जीज एंड पीपल डोंट गिव इट इनफ कंसिडरेशन. तो हमें बताइए, व्हाट इज दैट मैजिक फिगर, और कैसे पता चलेगा? बिकॉज आई नो आयुर्वेदा में टाइप्स होते हैं बॉडीज के, कैसे पता चलेगा?
Yeah, that's it. Magic figure is for every type different. So those who are underweight or just on the border weight, so they should sleep maximum. We call them Vata persons, Vata personalities. So they are not overweight, they are skinny, underweight type of people. So they should minimum sleep 8 hours. For adult person I am talking. And people, those who are overweight, they are kapha type of people. They have got tendency to put on. So they can do with 6.5 hours. They should not be sleeping more. They are not advised to sleep during the daytime. If they are doing that, they will get rhinitis or hay fever type of allergies more.
Interesting.
So they should not sleep more. Vata should sleep extra. 8 hours minimum. And Pitta is moderate. He is in state to do anything, anytime and anywhere. So it's we don't have to worry about him if he is leading his constitutional life. So Pitta is all right. Vata and Kapha, they have to take care of.
There's a call for you. Anonymous caller, if you can hear us. Hi, please tell us your question.
Okay, you know what happened? I got glaucoma and my tummy, I got polyps, and on top of polyps I got ulcer, and the polyps are in my nose. You know, and I can't sleep at night. And I am asthmatic also. And so many months, you know, I never slept. Doctor gave me, you know, some sleeping tablets, but he says after that I'm not going to give it to you. And I don't know what to do.
Yeah, you said glaucoma. It's a very, very typical disease. Your eye surgeon, eye doctor can help you out. You must take special treatment from the doctor only. You must consult him. It's otherwise very difficult for me.
I consult doctor. You know what happened? Doctor said go to the tummy one. You know, the gastology. Gastology said go to the opticians. You know, on the I went Moorfield Hospital. I'm really cheesed off, and I'm fed up.
Yeah, I can understand.
Spondylitis and vertigo and glaucoma.
Yeah, it's a multi-organ problem what you are telling me, and without examining, this type of disease can't be cured. You must understand that also. On telephone or on television show, it's very difficult for us to advise anything.
Thank you.
So better is to go to GP, please.
Thank you very much, there, Dr. Mehta.
Yeah.
Anonymous caller again है हमारे पास. Can you hear us? Hi there. If you can hear us, please tell us your question.
Hello.
Ji. Please tell us your question.
Hello, I want to speak to Dr. Mehta.
Yes, speaking and hearing you. Tell me.
Yeah, I just want to ask you, Dr. Mehta, why do I get night cramps in my leg?
Yeah, night cramps. It's a very good question. A lot of people are facing this problem. These are because of disbalance in your calcium and magnesium. And the second reason, yes, and second reason can be varicose veins. People like those who are standing whole day in the kitchen or in the shops, or teachers, they have to stand whole day for their profession. They tend to get this type of diseases. But you must try magnesium. You can buy magnesium tablets from your drugstore. This is freely available. And you must do that. And with this type of disease, you might have, I should not be asking on your telephone, this goes with piles also. People get hemorrhoids. So that's also one of the reasons. So these hemorrhoids you don't have, but this one can get this type of problem. So you please take magnesium and take warm milk at night and give gentle massage to your legs with sesame oil or mustard oil. This you should do.
Amazing. Thank you very much for that, Dr. Mehta. Thank you very much for calling, and all the best with the leg cramps, and we hope that you feel very absolutely fine very soon. Before I connect to the next caller, I'd like to say, अगर आप हमें call कर रहे हैं तो please जब आप connect हो जाते हैं अपना TV बंद कर दीजिए, वरना you'll always have that delay or we'll not be able to hear you. So please switch off your TV when you call us and just say your question straight away. Good evening, Dinesh. If you can hear us, please tell us your question.
Yeah, I can hear you, but very faintly. My question is to Dr. Mehta regarding COPD, chronic obstructive pulmonary disease.
Yes.
What is chronic obstructive pulmonary disease, and what are, besides bronchodilators, what are the available remedies? My name is Dinesh, not anonymous.
Yeah. Ji Janab, this COPD is a group of symptoms altogether for your lungs and heart problems. This is a combined name given to that. So in that it starts with always allergies. People from beginning, they have got bronchitis, allergic asthma, and because lungs and heart work together. In 1 minute, we breathe 18 times, 18 times, and multiply by 4 is our heartbeat. 18 multiplied by 4 is 72 times. Because of the bronchial problem, people have to breathe more in a minute. In place of 18, they might go for 25, 23, 24 times. Automatically, then the heart has to beat extra. That way, lungs problem converts into the heart problem. So that is combined. So bronchodilator is needed, anti-inflammatory is needed, but also what I can suggest you, that you must have antihistaminic also with that. Antihistaminic means anti-allergic, because it's always with on very latent level, people are allergic to a lot of stuff. So Albizia labec, Sirish. Sirish is the Hindi name, Latin name is Albizia labec. You can buy from Ayurvedic store and combine with that. And must avoid yogurt and banana. These two things we are not in favor of. If you can digest black pepper, it's very, very good friend of yours for COPD patients. So this is what I can advise you without examining.
Thank you very much, Dr. Mehta. Dinesh, I'm sorry about the error on the screen. We absolutely knew it's you, but thank you again for your call. Mr. Modi, if you can hear us, please speak to us and tell us your question.
Yes, I am here.
Please tell us your question, sir.
जी मोदी साहब.
हेलो. नमस्कार मेहता साहब.
नमस्कार जनाब.
मेरा एक क्वेश्चन है, जो सफेद मूसली पाउडर और चंद्रप्रभावती लेने से क्या फायदा होता है
जी,
और किस मात्रा में लेना चाहिए?
सफेद मूसली is one of the tonic. We say Bajikaran. It's used for impotency and sexual problems. And Chandraprabhavati is a tonic for your bladder. People having problems with bladder, urination, they can't hold urine or they can't pass urine. In both conditions, we give Chandraprabhavati. And bladder problem, urinary bladder. And Safed Musli, you have got different form. Every powder of Ayurveda, what we give in powder form is 2 times 5 grams. Has to be taken with warm milk. Then it's working for your sexual problems, impotency and things like that. It works on that.
Thank you very much, Dr. Mehta.
My pleasure.
Mr. Modi, thanks for your call, and we wish you a speedy recovery with any health problem that you might be facing. Dr. Mehta, one thing that I wanted to understand a bit more is that जैसे अभी बात कर रहे थे prostate के related bladder के बारे में, but research says that prostate problem is very common in men, and usually we don't spend so much time talking about men health issues. So I thought of asking कि often urine related problem होती है men में, whether it's frequent urination or that रुक के आ रहा है urine. So in that case, what can a patient do from an Ayurvedic perspective?
Yeah, you see, this is inflammation of the prostate. It's a topic on its own, requires a lot of time to make people understand, but it's inflammation on the prostate. Like girls, women get breast cancer or things like that, men get prostate cancer.
Okay.
So this is in our lot, is in our luck, what we say. So one can avoid this by having a typical exercise for the prostate.
Okay.
That typical exercise for the prostate enlargement, when there is swelling in the prostate, because when prostate is enlarged, it's pressing one of the nerve, and that nerve is attached to our brain. And brain, because of that inflammation, pressure on the vein, brain thinks that he has to urinate. It gets signal. So we have to decrease that inflammation. We have to cure that inflammation. So therefore we have anti-inflammatory tablets, medicines. So therefore is a very good medicine what we give, Chandraprabhavati, what he said. So these are very good, and Guduchi we give. There are few herbs what can be given, and exercise what I was explaining, that's that anus sphere, anus muscle, you have to contract. Nobody can see, but you are doing. Just contracting, you are just relaxing. Contracting, relaxing. You should do at least 25 to 30 times at a stretch, without non-stop. 25 to 30 times you should do once time a day. So that's going to give that sort of little massage.
And that would work whether they are frequently urinating or reducing.
Yes, because frequently urination is because of that impulses what brain is getting.
Or if they are urinating less.
Even then it will regulate.
Thank you very much. I think because men don't talk about it, prostate cancer is one of the key health issues with men. बहुत ही बढ़िया tip है Dr. Mehta से. Thank you, Dr. Mehta. Chandani, good evening. If you can hear us, please tell us your question.
Okay, I'm diabetic.
Yes.
And I've got problem with my both feet. The fingers, just the fingers. I've got pins and needles. Sometimes it gets hot, sometimes it gets cold. I've tried everything, trying to put my feet in hot and cold water. Had the acupuncture done, some massage done. I'm doing the massage with the oil. Nothing's happening. Nothing's working. Can you prescribe me?
Yes, I got your question very well. Same question was one of the callers. He had asked me this. With diabetic, there is always neuropathy as one of the complications. This is a complication of the diabetic. Because of the diabetes, your nerves are not getting good enough food, and it can't give that transmitted all the waves, all the signals. So that's why one feels hot and numbness in far area of your heart. That's in the feet or in your legs. So what you can do best is, I suggested earlier also, that Kounch, Kounch, Mucuna pruriens is one of the natural herb, as a sort of seed, bones. You can take that from any store, Kounch, and it has to be taken 5 gram morning, 5 gram in evening. And besides that, your house doctor, physician, GP can prescribe you Neuro Beyond Fort. Neuro Beyond Fort is the only medicine for this that is consisting of 3 vitamins, B1, B6, B12. And that best is to take via injection, not orally, because orally it doesn't get absorbed well. So if your GP is ready to give you, consult him, and that's going to make difference.
Amazing. Thank you very much, Dr. Mehta. Chandni, thank you very much for your call. Dr. Mehta, we just have about a minute and a half left, but I want to ask you a question because this came as an email. So a patient has said that, she's kind of allergic to green leafy vegetables and slowly to pulses like rajma, chole. So she was told that her intestine is weak and she has sort of a, weaker intestine now. So what can she do from an Ayurvedic perspective to, what happens is every time she eats something that doesn't suit her, she gets loose motions very frequently. So what can she do?
Yeah, it's certainly a digestion problem. So her liver has to be stimulated. And she should always ignite her fire before she eats. It's our duty. That whensoever we are going to eat, heavy meals we are going to enjoy, you have to ignite your fire first. So a little bit ginger with salt has to be taken 10 minutes before the food taken.
Raw ginger.
Raw ginger, you can take maximum to your thumb size, but don't have to take half of that with little bit salt. But give 10 minutes. That way your fire will ignite, and anything you are going to eat will burn well.
So just like maybe cut it in small pieces.
Yeah, that can be taken. And secondly, she should take always little less than required. If she eats 100 gram food, now she should take 80 grams.
Amazing.
A little less than required, and ignite your fire.
ठीक है, थैंक यू वेरी मच डॉक्टर मेहता. आपके साथ हमेशा समय कम पड़ता है, बट थैंक यू टू ऑल आवर कॉलर्स फॉर कॉलिंग इन, फॉर एवरीवन हु हैज बीन वाचिंग. वी होप इन छोटे छोटे तरीकों से आप अपनी ज़िंदगी को और बेहतर कर सकते हैं, बट रिमेंबर टू टॉक टू योर जीपी बिफोर यू ट्राई एनीथिंग ऑन. बट टेक केयर ऑफ योरसेल्फ एंड अंटिल वी सी यू नेक्स्ट टाइम. शब खैर.